Assalamualaikum and good morning everyone. Welcome to today's debate session. I'm Ashira Husna, metric number 080067. I will be the moderator for today's debate session. Today's motion is Paediatric Radiography should prioritize minimizing radiation exposure even if it delays the diagnosis or compromise the image quality. This topic is highly relevant in medical imaging, particularly in pediatric care, where healthcare professionals must carefully balance diagnostic accuracy with the long-term safety of young patients who are more sensitive to radiation. Before we begin, I would like to invite all speakers to briefly introduce themselves.
We are from supporting team from Ethical Consideration in Paediatric Radiography. My name is Liza Hanani binti Muhammad Yusof. My metric number is 079672. I am speaker 1.
My name is Nur Alia Shazwani binti Muhammad Kamal Zaman. My metric number is 080078 and I am speaker number 2.
My name is Mifati Fadisha binti Kamal Zaman. My metric number is 079686 and I'm speaker number 3.
My name is Nurul Balkis binti Muhammad Anwarde. My metric number is 080403 and I am speaker number 4.
We are from opposing team. My name is Wan Masturina Izzati binti Trimo. My metric number is 080092 and I am speaker 1.
My name is Muhammad Anib Islam. My metric number is 080635 and my speaker number 2.
My name is Muhammad Jay Shaikar bin Sabi and my metric number is 080961 and I am speaker 3.
My name is Zulaika binti Maslai. My metric number 079727. I'm speaker number 4.
My name is Fardatul Nur Ain Khair Anwar. My matrix number is 080141 and I am the moderator of Q&A session.
To begin our debate session, I would like to ask the proposing team, why do you believe that minimizing radiation exposure should be prioritized in pediatric radiography even if it may delay the diagnosis or reduce the image quality? You may present your point.
Good morning everyone. Today we firmly stand in support of the motion that pediatric radiography should prioritize minimizing radiation exposure even it may delay the diagnosis or contribute to compromised image quality. Children are not simply small adults. They are far more vulnerable to contribute to harmful biological effect of ionizing radiation. Because their cells divide more rapidly, their tissue still developing and they have many more years ahead for radiation-induced damage to manifest. This means even low doses of radiation can significantly increase their lifetime risk of cancer like brain tumor, thyroid cancer, or leukemia. This is precisely why radiation protection must be the priority. A diagnosis can be managed through alternative method, repeated clinical assessment, or safer modality like MRI and ultrasound. But the biological damage caused by unnecessary radiation exposure may be irreversible. Once radiation damage occurs, it cannot be undone. So every radiographic exposure contributes to cumulative radiation dose. And for pediatric who may require repeated imaging, this risk becomes more concerning. As healthcare professionals, our responsibility extends beyond immediate diagnosis. We must also safeguard the child's long-term health and future well-being. The ALARA principle is not optional. It is a global safety standard designed to protect the patient, especially children, from avoidable harm. Prioritize lower radiation dose, demonstrate responsible, ethical, and preventive healthcare practice. While the opposing side may argue that speed and image clarity are crucial, we must remember that the medicine is not only about protecting long-term health. A slight delay in diagnosis or modest reduction in image quality is a reasonable compromise if it significantly reduces the child's future cancer risk and lifelong radiation burden. So therefore, protecting pediatric patients from radiation exposure is not merely a technical consideration. It is a medical, ethical, and professional responsibility. For this reason, we strongly believe that minimizing radiation exposure in pediatric radiography must remain the highest priority. Thank you.
We oppose the idea that minimizing radiation should come at the cost of delayed diagnosis or compromised image quality. In pediatric care, timely and accurate diagnosis is critical and should not be sacrificed. So the patient's safety includes both minimizing radiation risk and ensuring the child receives correct treatment as early as possible. If image quality is too poor due to excessive dose reduction, important findings such as fracture, pneumonia, or intestinal obstruction may be missed. So this can delay treatment or worsen the child condition. Children also cannot explain their symptoms clearly, so radiographic imaging is very important for doctor to identify the problem quickly and accurately. In emergency situations such as head injury or severe chest infection, delaying diagnosis may place the child at greater risk than the radiation itself. Furthermore, poor image quality may require repeat examination, which can actually increase the total radiation exposure instead of reducing it. Therefore, while radiation protection is important, it should not interfere with obtaining accurate and timely diagnostic information for proper patient care. That's all.
We must consider the cumulative effect of radiation, especially children with chronic condition. It will require repeated imaging over time because its exposure will add up, increasing their lifetime risk. Even small dose can be significant when imaging repeated multiple times. Minimizing radiation in every procedure is essential to protect their long-term health. It's not just limited to a single case, but it has a real impact over time.
Speaker 2 from supporting team mentioned that we need to consider the radiation of pediatric patient, which is true. But in modern medical imaging, use a very low dose of radiation, and advanced radiology has made this procedure much safer and quick than before. The benefit of imaging also much greater than the risk, because the X-ray and CT scan can help the doctor diagnose early disease on the patient, monitor patient condition, and also provide proper treatment quickly. Furthermore, repeated imaging is only performed when it is medically necessary to the patient, and healthcare professionals follow in strict radiation safety principle, which is ALARA, to minimize the exposure. In addition, radiation from a single imaging procedure usually does not cause harmful effect because the dose is carefully controlled by the radiographer. Avoiding medical imaging due to the fear of radiation might delay the diagnosis and worsen the patient condition. Therefore, we believe that medical imaging is safe, controlled, and essential for the patient care. Thank you.
While immediate diagnosis is important, we must not overlook the long-term consequences of the radiation exposure to the children. Unlike adults, children have a more longer life expectancy, giving radiation-induced effect more time to develop. Even low doses of ionizing radiation can accumulate over time, especially in children with chronic condition who may require repeated imaging examination, such as chest X-ray or CT scan throughout their treatment. This cumulative exposure increases their lifetime risk of developing radiation-related conditions, including malignancies such as leukemia or thyroid cancer. Although delaying diagnosis may seem concerning, in many non-emergency cases, taking extra time to optimize imaging protocols, adjust exposure factors, or consider alternative modalities can significantly reduce unnecessary radiations without seriously affecting patient care. Prioritizing radiation protection today is an investment in the child's future health. It reflects a preventive approach in medicine, protecting patients not only from current illness but also from avoidable harm that may appear years later. Therefore, minimizing radiation exposure should remain a key priority in pediatric radiography, even if it requires additional time or slight adjustment in imaging quality.
Although minimizing radiation exposure is important, but image quality must remain diagnostic to ensure accurate and timely treatment. If exposure is reduced too much, image may become unclear or non-diagnostic, leading to misfindings, delayed diagnostic, or repeat examinations, which may actually increase the total radiation dose. Child with conditions such as fractures, pneumonia, or congenital anomalies require a clear imaging for a proper measurement or immediate clinical decisions. Modern imaging technology already allows dose optimization while still maintaining essential image quality. Therefore, Paediatric radiography should focus on balancing radiation protections with diagnostic accuracy rather than prioritizing dose reduction at the expense of patient care.
In terms of ethical responsibility, the healthcare professional have an ethical responsibility to protect the patient from unnecessary harm, especially the children. This follows the medical principle of do no harm. Children are more sensitive to radiation because their cells are still developing and they have a longer lifetime ahead them. Therefore, every imaging procedure must be carefully justified to make sure the benefits are greater than the risk. One important ethical approach is using safer imaging methods such as ultrasound, MRI, whenever possible because they do not use ionizing radiation. Healthcare professionals can also optimize imaging techniques by lowering exposure factor, reducing repeat scans, and using pediatric protocols. Sometimes accepting slightly lower image quality is reasonable if the image is still diagnostic, because patient safety should always come first. The opposing team may argue that lowering radiation dose can affect image quality. However, in modern technology, can still produce a good diagnostic images at lower dose. Preventing unnecessary radiation exposure does not mean avoiding imaging completely. It means making responsible decisions that balance diagnosis and patient safety. This reflects ethical practice and good clinical judgment.
I support the statement that healthcare professionals have an ethical duty to protect patients from unnecessary exposure, especially in pediatric imaging. But I partly disagree with the concept of radiation protection by using alternative techniques like ultrasound, MRI, to replace routine plain radiography. Plain radiography is often first-line imaging modality because most common pediatric cases, especially for falls or suspected fractures, the most appropriate routine imaging method is still plain radiography. It is fast, accessible, cost-effective, and mostly important is highly effective for bone injury. Yes, MRI and ultrasound is useful, but in selected cases and not practical as routine replacement. Then I also disagree with the idea of lowering exposure factors to reduce dose. In emergency imaging, if the exposure too low, it will affect the image quality, image become unclear, which can lead to missed fracture, misdiagnosis, or repeat exposure, and result in increased dose overall. Therefore, the correct approach is not simply to reduce exposure at all costs, but to optimize it, like use proper positioning, strict collimation, and minimize exposure factors. The goal is not the lower dose possible, but the lower dose that still give a diagnostic image. So in conclusion, even in pediatric imaging, healthcare professionals must always consider benefit over the risk. Radiation protection is important, but avoiding radiation should not compromise diagnosis. Thank you.
Now, let's move on to Q&A session. For supporting team, I have two questions. Question 1. If image quality is compromised, wouldn't that increase the chance of repeat imaging and eventually expose the child to more radiation?
To answer the first question, that is a valid concern. However, our argument is not about producing non-diagnostic image. We support optimizing exposure carefully while still maintaining acceptable diagnostic quality. With proper technique selections, positionings and modern imaging technology, radiations can be minimized without significantly affecting diagnosis.
Second question. What if reduced radiation produce poor quality images that require repeat scan?
For the second question, minimizing radiation exposure does not mean sacrificing the diagnostic quality or producing unusable image. Instead, it involves carefully optimizing imaging technique through a specialized pediatric protocol, appropriate shielding, and accurate positioning, and modern dose reduction technology. Skilled radiographers are trained to balance the radiation safety with sufficient image clarity, ensuring that image remain diagnostic while avoiding unnecessary exposure. The goal is not to underexpose the patient, but to use the lowest effective dose possible. By applying this strategy correctly, healthcare professional can reduce the radiation risk without significantly increase the likelihood of the repeat scan, thereby protecting both immediate and long-term patient safety.
I have one question to ask to the opposing team. If children are highly sensitive to radiation, why should immediate diagnosis be prioritized over long-term safety?
Because untreated or delayed conditions can immediately threaten the child's health. The proper performed radiograph uses controlled doses, but delayed diagnosis may result in severe complications or disease progression.
I have another question. Do you agree that repeated exposure increases lifetime cancer risk in children?
We agree. It is why radiographer use dose optimization technique. However, compromising image quality may actually increase the repeat imaging, causing even more radiation exposure overall.
After evaluating both sides, the deciding factor lies in diagnostic urgency versus patient safety. The supporting team rightly emphasized the importance of minimizing radiation exposure and protecting children from long-term risk. However, their approach may unintentionally compromise timely and accurate diagnosis, which is critical in acute and life-threatening conditions. The opposing teams raises stronger concerns regarding delayed diagnosis and reduced image quality, both of which can directly impact clinical decision-making and patient outcomes. In pediatric care, even small delays or missed findings can lead to disease progression, complications, or inappropriate treatment. While radiation risk exists, they are carefully controlled in modern practice through strict protocols, dose optimization, and justification of every examination. Importantly, the immediate benefit of an accurate and timely diagnosis often outweighs the relatively low risk associated with properly managed radiation exposure. Furthermore, minimizing dose should not come at the expense of producing non-diagnostic images, as this may lead to repeat examinations, which ultimately increasing overall radiation exposure rather than reducing it. Therefore, ensuring diagnostic accuracy and timely intervention remains the higher priority in clinical practice. Based on the importance of immediate patient outcomes and effective clinical management, the opposing team wins the debate. That's all.